Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you about a test that's done to determine if there's weakness in the glute medius muscle, and a great exercise to do to help with this potential weakness. But before I begin, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So the test I want to talk about is something referred to as the Trendelenburg Test. And so essentially what this is, it's when we have a patient put all their weight, right, balance on one leg to determine if they can keep their pelvis parallel. And so what'll happen is when the glute med muscle, which is the muscle along the side here, when it's weak, right, the pelvis will actually drop. So its job, as I mentioned, is to keep the pelvis parallel. So what we'll do is we'll have the patient essentially balance on one side and assess to see, hey, does that pelvis stay parallel? Now, a Trendelenburg stance or a gait pattern, what'll happen is when the patient puts all their weight on the one side, the pelvis drops and they simply can't keep their pelvis parallel. And so that's one of the signs that will indicate, again, glute med weakness, and that muscle needs to be strengthened. So one of the exercises that we'll give, typically when they're actually able to weight bear more pain-free, maybe we've done some exercises to isolate that muscle, so perhaps some straight leg raises out to the side. And then from there, what we can do is have a patient do what's referred to as a hip hike exercise, where essentially they're balancing and they lift up, right, the opposite side. Now, a lot of times what we'll do is we'll have the patient actually do this hip hike exercise on a step, where they're starting with the pelvis slightly lower and then lifting up. And when you're doing this, you want to make sure, again, you're keeping your knee straight, and the movement essentially is just taking place right at the pelvis area. We also want to minimize the use of obliques or the QL muscle or any muscles in through the trunk area. So again, the movement is just taking place at that particular muscle. If you have any questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.